Hi everyone, and welcome back to the GuideWell Insights Lounge. We're here on location at the Oliver Wyman Health Innovation Summit. Hi everyone, my name is Kate Warnock, and I'm so pleased to bring our next guest, Sean Duffy. Sean, welcome to the interview.
Thank you, Kate. Happy to be here.
We're happy to have you. Sean is the co-founder and CEO of Omada Health. So Sean, I was looking into your company and your background, and tell me, what is the gap that Omada Health helps to fill for people who are suffering from chronic diseases?
So as you gain weight, your body reacts and it tends to lead you more toward chronic diseases like diabetes, heart disease, et cetera. And there's this amazing body of literature and science that shows that intervening in the right way for the right people at the brink of chronic diseases like diabetes can make a big impact in their risk reduction. So, my background's a mix of tech and medicine, and in medical school, I remember I just kept reading about all these fabulous clinical studies that show what you can do. Yet, before Omada, the vast majority of programs that could be delivered for people are done in person, which creates its own whole host of challenges because they require multiple touch points, et cetera, and it's really hard to get people into a physical setting for these. And
Sure.
so Omada is, filling that enormous hole of being able to scale these interventions and deliver them on the other end of an internet connection with similar or better efficacy.
And everything that you're doing is all evidence-based, isn't it? So, a lot of research has gone into the model that you've developed. Do you want to tell us a little bit more about that?
Yeah, so the clinical backstory is that in 2002, this amazing clinical trial came out called the Diabetes Prevention Program, and they took 3,000 people with prediabetes, so at high risk for type 2, and they randomized them, and for 1,000, they brought them through a very high-touch program in person that targeted a modest amount of weight loss, done in the right way. It's a very behaviorally forward way to help people make lifestyle change. Then they tried a drug, and then they had what is unfortunately standard of care in the country still, which is handing the curriculum to someone and just praying that they go off and make changes on their own, which doesn't happen.
Right.
So the program had the best results of all these arms. There was a 58% risk reduction in the conversion from prediabetes into type 2, and it kicked off this fabulous cascade of clinicians wanting to bring these insights to bear, and every bit of our program is based on that body of evidence.
Terrific. Well, one thing that I was also researching about Omada, I think that you recently posted a blog, and it was all about alignment of payment.
Mm-hmm.
So payment
Yep.
that enables
Yep.
innovation, and you cited even CMS's payment for diabetes prevention programs as
Yep.
proof. So how can funding continue to improve population health?
Well, what's interesting, about the payment in the space at large is it's really one of the, kind of a shining example of outcomes-based pricing. Omada, when we first started, we had an outcomes-based pricing model. It was funny. At the time, I had worked in tech before heading to medical school, and when I started the company, that just seemed so obvious. I think I didn't know how innovative it actually was looking
Right.
back. But we just decided to price on our outcomes. At Omada, we match people into groups. We get them a scale that's got verified and validated data coming back in. And I figured if that's the clinical endpoint that the community at large assigns value to, why don't we charge for that? And in this space at large, value-based arrangements and outcomes-based pricing are more common than other areas. And CMS took foot there, and their pricing model that they're shaping for benefits design launch on 1/1/18 is going to be outcomes based, and
Right.
it's we hope that there's a lot of other interventions and programs that follow suit.
You're really leading the way, though, and how exciting to be in this space and with the experience that you've got. I wanted to pivot a little bit,
Sure.
Sean, about your background.
Yeah.
You've mentioned being on the tech side. When looking at your resume up on LinkedIn, you've worked at Google, you've worked at IDEO, you've done MedGadget. All of this experience really seems to have positioned you perfectly for your position in founding Omada Health. So tell me what experience has translated into the company that you run today.
Well, it's funny. So I grew up in Colorado. My dad was an engineer. My mom was a nurse. So I've always been somewhat of a hybrid between kind of a tech geek and just drawn to healthcare, just for the simple reason it felt like a great way to help people.
Yeah.
So I studied neuroscience in undergrad, neuroscience and behavior at Columbia. Graduated at a point where Silicon Valley was just blooming. It was an incredible moment in tech history, and I'd done all the pre-med recs. I was thinking about maybe going to med school, but at my core, I just felt drawn to technology. So I worked at Google for a couple of years, had the ambition to do something in the tech meets primary care space. Went off to medical school, then while in medical school, took an internship at IDEO that led to the company. And what I've always felt I can most do to serve not only our company internally, but just ideally the community at large, is help build bridges between the tech world, which used to be over here, and the healthcare world, which used to be over here, and increasingly there's conversions.
Yeah.
And it's a beautiful thing when you have executives at your company that prior to Omada they ran all of post-enterprise sale for Google Apps, and this is their first healthcare gig. And then for others, prior to Omada, they led the commercial organization for Counsel. This is their first tech gig. So
right.
that blend, I think, is powerful for not just what we do, but is one of, in my minds, the least talked about and most interesting things that's happening right now to dramatically catalyze innovation in healthcare and spawn a whole host of new ways for delivery.
Well, that's really exciting. I mean, that's absolutely, it's so much about really what the summit is even about here is talking about the consumer imperative and who are the players that really have to contribute to that. So,
no, totally.
One more question for you.
Yeah.
So, as I just mentioned, Oliver Wyman has convened all of these industry leaders here at the summit to discuss how healthcare can be transformed from the outside in. What's the role of the primary care doctor in this transformation?
I mean, it's funny, for us, we love to be thought of as almost like a specialty center for these programs. And when a primary care doc who may feel powerless to help a person make lifestyle change, help a patient lose weight, to refer into us and trust us to deliver all the needed multi-component bits to ensure success with a person is a fabulous result. So we want to engage at that level. I also think, but at a more meta level, the concept of primary care is dramatically shifting. I think primary care of tomorrow will be thought of slightly less as a specialty and more as a concept, in that you will build, as a patient, a primary care brand affinity with a health system, maybe a Mayo, a Sutter, and the way that system routes you, cares for you, introduces the right people, manages acute, things that pop up in your daily life, manages chronic, you'll feel that as a patient as primary care. So I think that's already starting to happen in many ways, and will continue. And Omada's job always in engaging either at the PCP level or at the system level is to be thought of as where someone can be sent when it's clear that their weight's caught up to them to the point where they're now having early cardiometabolic problems.
Right. So it sounds like you're really presenting a future that continuity of care, the continuum of care, really is much more integrated and seamless, which really is so much better for the patient at the long run. So, and
I think it'll happen. I think technology and innovators here can get it there. So.
Right. Well, Sean, thank you so much for your time here today with us at the Guyville Insights Lounge. My name is Kate Warnock. Thank you so much for watching.